Perfect. Okay. But without any further ado, we have the a poll that is on the screen before we call on our speaker. If you can take a moment to complete this poll, this would be great. There are just three questions to answer. Just take a second right now. Let us know what your current profession is, where you're located. If you don't see that on here, you just click on other. These are the 11 states we were talking about, but we know some of you are in other areas. So please fill out the poll that just popped up on your screen. That would be great. And answer the which statements, following statements describe you currently. So take a second to answer that. And then we do have some operating agreements that we're going to share at the moment. We would love for you to stay on mute when you're not talking. It just helps us with the presentation and timing as well. Use the chat box for questions, but we will ask you to come off mute for Q&A or anything the host would like to ask you. And if you need to take care of yourself, please do. If you need to step out for a little bit, that is number one. Just take care, do what you need to do to take care of yourself, okay? Um, you- I'm assuming everyone was able to fill out the survey. Okay. All right, wonderful. Okay, so I will have the wonderful opportunity to introduce you all to Leslie Wolf, who is from Envision, who will be presenting, putting it all together, a deeper dive into the CHW Financial Sustainability Toolkit. So let us give her a round of applause. And let me see some emojis on the screen because I know you're excited about this topic. Let me see some emojis. Yeah, we got some claps. Look, we all welcoming you,
Awesome,
Leslie.
awesome. Thank you, thank you. Thanks, Soledad.
You're
Hey
welcome.
all, hey friends. Welcome. We're gonna have some fun today. Um, all right. I'm managing screen sharing and presenting, so a little grace on your part because this is not my favorite skill set. So you're gonna hang out with me while I try to make it as smooth as possible. But all right, so we are together for, as Soledad said, right, putting it all together, a deeper dive into the CHW Financial Sustainability Toolkit. Um, Really glad you're here. If you joined us for the earlier webinar, we explored different pieces of of financial sustainability. And today is really intentionally different. We're going to spend less time talking about financing and financial approaches and the different pieces of the toolkit, and more time actually using the toolkit. So we're going to look at sustainable financing through a particular lens, which is really what role can CHWs play in shaping it? Because CHWs may not be the people who approve a budget or negotiate a contract, but that doesn't mean CHWs don't have an important role in as these decisions get made. So I'm gonna, first of all, I'll be putting that link in a couple times in case people join. But while I'm chatting at you, I want to make sure y'all get a copy of the toolkit if you don't have one already. So I put a link in the chat there to grab that toolkit and download it. So, as Soledad said, right, my name's Leslie Wolf. I use she, her as my pronouns. I'm the director of programs for Envision. I'm based in Madison, Wisconsin. I'm a CHW ally and a community organizer by trade and in my heart in everything I do. I have over 20 years of experience supporting communities and coalitions to advance community-led policy and structural change. And uh, the toolkit that we're looking at today, a lot of that expertise, right? A lot of that framework of community organizing really built out how we do in the toolkit. And a lot of what we're doing today is actually going to be digging into those organizing frameworks and skill sets, but sort of a real mini version of it because Not unlike CHW profession, organizing is a profession, right? That takes years and years of building that skill. But so we won't do all of that today, but we'll do a mini version of it. Um, all right. Whoopsies. I'm supposed to be advancing my slides while I'm talking at you about all this. So we said that. Okay. And for those that don't already know about Envision, real briefly, Envision is a CHW-led collaboration of expert community health workers and CHW allies who provide support, guidance, technical assistance, and training to organizations and individuals nationwide. And we are a partnership of the Wisconsin Department of Health Services, the Center for Community Health Alignment, right? Our friends here, CHWA, University of Wisconsin Population Health Institute, that's where I'm based, and Louisiana State University. Okay, and um, let's see. Let me get to the next slide. I already said this. Grab the tools. Link is in the chat. I don't know if anyone new has joined since I put that link in, so I can put another one in just in case. All right. So
And I'll keep adding the link as folks come.
thank you, Soledad. Thank you.
Yep,
Thank you.
no
I just want to
problem.
make sure everybody gets it.
Yep.
All right. So today's question is really, if CHWs aren't making the funding decisions, what role can CHWs play? So that's really what we're going to explore today. We're going to explore it as we go through the toolkit because the toolkit is really meant to give that answer throughout. So what can CHWs actually do? What knowledge do they bring? Who can they influence? What relationships matter? And how can CHWs help make sure that financing strategies actually support the work communities need? All right. And I'll say, we're not expecting you to leave as financing experts or with a completed advocacy plan. We're really aiming for three practical things. We want to expand what you see as possible. We want to identify who makes and influences decisions and what matters to them, and start a strategy. So start thinking about strategy and having actually a bit of that written out. So you are going to be putting some pen to paper here today. And you'll see that those same three ideas get reflected in the evaluation at the end, right? You got maybe saw some of that in the beginning. You'll see some of that in the end. Um, so, oh yeah, here's my another reminder, get the toolkit. This is really important because we are actually using it. So that's why there's so many. Hey, don't forget, get the toolkit. And for our purposes of today, we're gonna focus primarily on sections 5 and 6. And I'll guide you to specific parts throughout the session. So we're skipping ahead to the end. The toolkit's got 6 sections in it. We're skipping towards the end. Okay. And this reflects the toolkit's framing that securing resources is one of 4 interconnected approaches to sustainability, and that community leadership is really foundational. So when we hear the words financial sustainability, it's easy to immediately think about money. And that's absolutely important, right? Where will the dollars come from? How much will reimbursement be? What grant can we apply for? But the toolkit actually gives us a much broader definition of sustainability. It identifies those 4 interconnected approaches: community leadership, policy change, institutionalization, and securing resources. And importantly, community leadership sits at the foundation. So today we're going to think about financing through that lens of how does CHW leadership help shape sustainable financing. And when we talk about CHWs participating in financing conversations, I don't want to reduce the role to simply telling stories, though stories are very important, right? They're essential. Um, Community voice is important, but CHWs bring something else that's critical, which is that practice-based and implementation expertise. So right, CHWs, you know what it actually takes to do the work. You know whether a requirement is realistic. You know whether a proposed financing strategy supports the full scope of the role. and you know where a funding or policy requirement could create barriers for the people you're serving. So a financing strategy can look great on paper and still fail in practice. And CHWs are often in a unique position to see that coming. Yes. Okay. So to really punctuate that point, CHW involvement isn't just about asking someone else to fund your work. CHWs can contribute to designing better financing strategies. You can explain what the work requires. You can connect financing to community priorities. You can identify potential problems. You can bring evidence and stories. And you can help determine whether a strategy is actually workable on the ground. And that's the role we're going to keep coming back to throughout today. All right. So with that, I'm going to start us off with a bit of a reflection. I want you to take a few minutes, right? Before we talk about advocacy, financing, all these things, I want to start with something you already know how to do, which is influence. Think about a conversation you had about CHW work. Maybe it was with a supervisor, an organizational leader, healthcare partner, funder, community organization, or policymaker. What did you know they needed to know? And what did you share? So I want you to just take a few minutes to think about that, right? Think about who are you talking with? What did they need to understand? What did you bring to that conversation? And then I want to invite y'all to put one thing you brought to that conversation in the chat. And if some of you were thinking, oh, I thought I was just going to sit and um, listen and not have to participate today,
Mm.
that is
And,
not the way today's going to work. We're all going to participate.
and I'll let you know what comes up in the chat.
Thank
So we
you.
have experience.
Awesome. Yes,
Okay.
experience.
Mm-hmm.
You brought experience. What else? What did others bring?
Phyllis said a connection between two people.
All right. Yes. So a connection, a relationship.
Perspective from Trivia.
Yes.
Yep. New
Yes.
perspective as well
Perspective.
from Juliet.
Yeah.
Juliana.
Perspectives. Okay.
Yeah.
Compassion and understanding. I see
Yeah.
that. Thank you.
Mhm.
I got my chat to work.
Okay.
I'm good. Thanks, Soledad.
Mhm.
Um, keep it coming, y'all. And as you're putting things in the chat, I think the thing to really elevate here is you're going to use those same skills today in thinking about this work, but as you go forward with your work, right? But applying them to financing. It's the same skills. It's the skills that y'all already have. Okay. Ooh, illumination.
Mm.
Yeah, good word. Okay. So same skills y'all already have, just applied to financing, which maybe you've done as well. Okay. Get this to work. So this is our destination. This is sort of our path today. Um, we are going to build this one piece at a time. You don't need to figure out your entire sustainability strategy today. We're going to start with something real, explore it through the toolkit, and see what possibilities emerge. All right. So first, we're going to choose something real to anchor our exercises. I want you to think about one thing from your work that you want to keep doing. Maybe it's a CHW position, maybe it's a program, a service, or a particular activity. You don't need to know how you're going to sustain it. You don't need a financing strategy at this point. You just need to pick something real that you care about keeping. So with that in mind, I'm going to give y'all about 3 to 4 minutes. Um, And this is not your sustainability goal, right? We're not asking you to solve sustainability right now, just simply choosing something real to carry you through the workshop. So we'll take a few minutes here, and then I want you to write down the CHW work I want to keep doing is whatever that is. Why do I care about keeping it? because that's important, right? Why? Why that? Any questions about that exercise or what I'm asking y'all to do? Because this is going to anchor the rest of our activities. So I want to make sure there's clarity here. Okay, I'm going to bring us back together at 56 after. So I'm going to give you 3 minutes.
Hey Leslie, I missed my room.
Oh no, we're not going to, sorry, I should have been
Okay.
clear. We're not going in breakout rooms. I didn't have a setup for breakout rooms for this. This is really more throughout the time together. And actually we're a small enough group that we can probably chit chat in large group at times. But largely this is going to be something that you'll do as individual reflections and individually moving through the toolkit. Really you getting to know the process. Yeah, thanks for that clarification. Appreciate you. And Jasmine, thank you so much. I see that you've shared something in the chat. You've gotten ahead of me, which is amazing. You're setting the stage here. If you're comfortable, would love for folks to share the type of work you're thinking about in the chat. You can share to whatever degree. Oh no, you're wonderful. Thank you. I love that you did that. Uh, uh, please share to whatever degree you feel comfortable with what you're thinking about as your one thing.
All right, so I have a senior that needed to do a Medicare Savings Program application because her income is just so low. And unfortunately, let's see, I did this application actually in April. She just received the notice last week saying, I need this documentation, that documentation, and it had to be submitted by tomorrow. She was not going to be able to mail it in time. So thankfully, through my job, they actually gave me a portable scanner, which I was able to do that for her, scan it and submit it directly to DHHS for her. But it's like, a lot of people, they just don't have the means. They don't know to go to the library. They can't use a scanner. And a lot of my seniors just don't have that. They're just unsure. So as long as I'm always able to be able to be of service for them and be able to help them out. And she actually sitting there watching me scan everything, making sure and checking the paperwork, like double checking the letter from DHHS with what they were requiring from her and how to email it, and just putting her reference number and just giving her more advice as to how to just keep checking on them to make sure that they received it so that she doesn't get denied. Made such a difference for her, and she actually got teary-eyed and was like, oh my God, I love you, Jasmine. You're like the best thing in the world, because I wouldn't know how to do this on my own. So that's what keeps me going all the time. It's just that ability to help somebody and make the just take a little bit of that burden away from them.
Amazing. Jasmine, thank you so much for sharing and for elaborating. Um, and what a perfect example of the kind of thing that I'm hoping folks will come up with, right? When you're thinking about what's the thing that it just has to be real, it just has to be something that you care about. And Jasmine, you clearly care so deeply. Um, so hopefully everybody's got their one thing. It's all right if you didn't feel like sharing, that's all good. Just want to make sure everybody's got their one thing that you're going to focus in on as we move through activities. Okay. So with that in mind, right? Want you to have that, consider your one thing, right? And before we jump into funding sources, we're just going to take a step back. And if you want to sustain something, we need to understand what we're actually sustaining. So we take the CHW work you selected, whatever that is, right? If you take Jasmine's example around, working with seniors, um, thinking about, okay, well, who benefits from that kind of work? What changes because that work exists? What community priorities does it help address? And who else might have a stake in those outcomes? Who else might care, that seniors are getting their needs met? We're not really looking for funding yet. We're just simply looking at the work through a wider lens. So I want you to take just a few moments here, and you can jot down some notes alongside this, right? Alongside your, hey, my one thing. Think about this. Who else, who benefits? And what changes because this work exists? What community priorities does it support? And who else might care about these outcomes? So again, I'll give you some time to just do a little self-reflection. About 3 minutes or so. All right, as folks are starting to wrap up, I would love to invite either comments in the chat or if y'all want to come off mute, either way. What did you come up with for who else cares about this? Who else cares about the outcomes your CHW work creates?
Hello. What I cared about was creating a sustainable services and programs in my community. I feel like having the resources already, I'm saying readily available, but what I'm saying is basically like whatever we start, we're building onto that so that it's easier when I either move on to something else or whatever, that whoever comes in after me, that they have the resources already there, that it's not hard, they don't have to work twice as hard. It's already there. The community knows about it. They can educate the person that's coming in, but it makes it a lot easier. So who benefits from this is the community, already being educated about it. They're able to educate the next CHW or anybody that's, community leaders. It changes this works because it helps have something that's already being maintained, and all you have to do is just to add on to it, um or take away, but you it's already in place, and it's you don't have to work as hard. And I said that, what community priority does it support? I said sustainability of having the services and programs, that you don't have to create, a whole new program or service. And I said, who else might care about this? I said, community leaders, advocates, doctors, all those involved in the services and programs that's being provided.
And so you're really speaking to, kind of the holistic presence of CHWs in community, just to
Correct.
clarify.
Yes.
Yeah, yeah, yeah.
Yes.
Yep. Yeah. Okay. Thank you. And Jasmine, I see your comment in the chat. Community knowing is important. That's how it keeps going. Lack of knowledge is how resources disappear. Yeah, did you want to uh speak to that a bit more?
Yeah, I think sometimes someone will try to create a resource like a food pantry or even teaching a class on something so basic that most people are like, oh, that's not going to work. But it might be a tool or a skill that they can turn into like income for themselves or even something that just serves. But when it's not known about, they lose their funding because it's like, oh well, nobody's really interested in what you're doing, so it ends up disappearing. And it could be something that's actually beneficial to the community or to just an individual altogether. So sometimes, those things are very important, just to kind of put yourself out there so that way people know and hear, and you spread the word, and one person, one CHW knows of a client that can benefit from that, and it definitely helps out. But if not knowing anything is how things just disappear and kind of go off to the dust.
Yeah, I think that's a great point. So, I think that the activity of promoting a resource in and of itself is something that, we're talking about. We're going to get into funding, financing, all that, right? Promoting an activity is something in and of itself that sometimes can be a space to get funding from others, because if it benefits them because it doesn't put as much strain on their organization, maybe they're willing to invest in promoting what you're already doing. Um, so something to consider, which is where, this sort of line of thinking comes from, is what's the stuff? What's the stuff that we need, that we want to keep doing or need to figure out ways to fund to do. Um, Brad and Jasmine, thank you both so much for elevating what's going on in your minds. Other folks, other things you want to build on that, add to. Maybe you're thinking about a person, an organization, or a sector that might care about the outcomes of that your CHW work creates, or might benefit from it.
Yeah.
Ah, there you go.
Yeah. The value prop offered What will add value for orgs to pay for this?
Yeah, yeah. Well, we'll add value for orgs to pay for this. That is right. That is exactly the mindset. Thank you for offering that, Dina. If at any point I say someone's name incorrectly, please do correct me.
You said it perfectly. Most people say Deanna, so thank you.
Yeah. Okay. All right. So what did you notice, right, in that conversation? And Dina, you already sort of started to bring that up, right? Um, sorry, I'm gonna advance this a little bit, but what did you notice in there about when you were starting to think about who else cares? What did you start to did you get any more creative? Did you happen to get outside of the box of where you've been before when thinking about your work? Did you go to sort of oh, those are the same folks that have always funded, or did you find your way into other partners, relationships, considerations? Ryan, I see a head nod. Yeah, say more, please.
Well, yeah, I was just gonna say, just like having more thought and options involved of like different, because people come from different backgrounds, different experiences. So, people have tried different things that, may potentially still work for our services and programs, something that we may have not have thought about before, that may work for that specific time. Because even though I say, we have something that's already that we're maintaining and we want to sustain that, but it's a different time now. So we might need to think about a different kind of way of that approach, like not saying staying the same way for 20 years. Now is a different time. These kids are different. When we think about literacy is a big issue right now, but when we think about like what was different back then from now, that really increased with literacy, we have so much more technology, so many other things that can help and potentially reach the youth now. So I just use that as an example, but
Yeah.
it still relates to community health work. But yeah, just growing off of what we have, that we don't have to think so hard, and having the different experiences and backgrounds from our resources that we already have.
Right on. And it's a great example. I think sometimes those parallel examples, when we're thinking about our work, when we start to look at parallel examples, it also expands our mind a bit to see, how other things have really, expanded and changed and grown with time, right? And you're right, things are different now. And with all of those possibilities and with all the different ways that we can connect with one another, it's both expanded and contracted our ability to connect with each other. And so we're wanting to spend more time in that expanded space, even though, in some ways, like our worlds have gotten so big, and then at times, thanks to technology and other things, right, our world actually can feel quite bubbled and small. So a lot of this exercise is about, yeah, breaking out of those bubbles and expanding, and thinking about things just a little bit different. And look what just happened, right? You started with one CHW activity, but when you looked at it from different perspectives, you may have found several outcomes, populations, or priorities connected to that work. And that's the idea we need, before we talk about anything like we're gonna get over to braided and blended financing, but we really want to get that concept in mind first of, this idea that we get into a really creative space when we think about financing outside of our single sources or single relationships that we've had. The CHW role hasn't necessarily changed when we're creative that way. What's changed is our understanding of all the value that role creates. Okay, so when we think about that, right, the idea then is we're going to take it and move one step further. If multiple systems or organizations benefit from the work, from a CHW position, from initiatives that we're working on, could there also be multiple resources that could contribute to sustaining it? And that's where braided and blended financing can become really useful. And so we're going to open the toolkit. I've got 4 stops on the toolkit. So you'll see this thing, right? It says like toolkit stop, which is basically like, we're not looking at the whole thing. We're just gonna move through a couple different spaces of it. First stop is in section 5, which is where we emphasize braided and blended funding as strategies. So open the toolkit. We're going to explore section 5. It starts on page 62. And we're not going deep into how to use all the different parts of the section, the worksheets in the section, et cetera. But we're really just using it to sort of explore funding possibilities. And thank you to Soledad for putting that in the chat again. All right, so while y'all are getting there, I'm going to do a quick overview. We're not going to spend a lot of time on definitions, but I've said these words braided and blended a couple times, and so we got to land on what these are. The important distinction is that blended funding brings resources together into one single fund. So you can see the blender image, and the idea is like a smoothie, right? All the distinct ingredients go in. And come out as one delicious smoothie. So, if you have 7 different funding sources, how you experience it is like one. And then braided funding coordinates multiple resources while keeping track of each source's requirements. And braiding is often more common because in CHW work in particular, because many public and grant funding sources have specific requirements for how funds are used and tracked. So we frequently are doing more of a braided approach, where, there's multiple strands, if you will, of a braid that come together. So we're experiencing one braid, but it still is for each part of the work, for each part of the position, there are distinct requirements associated with those. The bigger idea today is really that us thinking about, could different resources support different aspects of the work, because different people or systems benefit from it. So that's really the main takeaway when we're thinking about braided and blended today versus getting into all the different ways that we might manage or strategize around putting it into practice. The toolkit does give some of that information, but today we're really just getting into that other mindset. Could different resources support different aspects of the work because different people or systems benefit from it? So I'm going to take you through an example that's in the toolkit. On page 67 is this example, which is an FQHC. So the FQHC example, or a federally qualified health center, FQHC, they can hire CHWs to support Medicare clients through community health integration reimbursement. So that's one way that they're paying for CHW work, is through Medicare. And in some states, Medicaid clients through a state plan amendment or waiver, right? So they can use those types of funding sources. The FQHC could provide, track, and document CHW services according to Medicare and Medicaid rules, and then bill those programs for the time the CHW spend with each client. And then the FQHC could also have a grant from a community foundation to support migrant workers with access to care and housing needs. And by using the funding source that matches each client, Medicare, Medicaid, and a foundation grant, the FQHC can braid these funds together to create a steady, sustainable revenue stream for their CHW positions. But notice that the organization isn't relying on one funding source, right? So it's not like, oh, everything we do is Medicare, everything we do is Medicaid, or everything we do is the foundation. And oftentimes it would be a lot more funding than just these 3. This is just a simple example. But the different resources are supporting different aspects of the work. So you don't necessarily have to memorize all the financing mechanisms. Instead, I just want you to think about when you see this type of example, think about why is each funding source willing or able to support CHW services? So from the vantage point of, Medicaid, Medicare, Foundation, like why would they be interested in supporting or having funds be used in that way? And when we think about that, what population do they care about? What outcome or priorities matter to them? And what part of the CHW work connects to that? So that's really the framework or the mindset from the toolkit. And you can see that in this table here that sort of illustrates the example. Okay, so now let's apply that thinking to your own work. I'm going to have you open up section 5 and look for possibilities. So this is really just like kind of taking in what's in section 5. And again, that starts on page, I'm going to make sure I have the page number right. I think it's 62. What I said before. Yes, 62. So as you kind of just explore, I want you to think about what funding sources might have a reason to support some of the work that you identified, that you're like, hey, this is my one thing. This is the thing I'm looking to sustain, or the position. What partner might have a stake? What community priorities connect to that? Could different resources potentially support different parts of the CHW role? So you don't need to know that the strategy will work. You don't need to know all the rules. So, if you're like, oh, Medicaid, but I don't know anything about Medicaid, that's okay. Just don't need to know any of that. And you don't need to build a complex funding mix. We're just practicing seeing possibilities. That's really it. So we're just looking at the section to try to take in some possibilities, some brainstorming. And as you do that, identify maybe one potential funding pathway or funding source, maybe one potential partner, maybe one community priority. And maybe it's just one of those things even. And I'm going to give you all a nice chunk of time to do this. We'll spend about 5 to 7 minutes. So it gives you time to actually read the section a little bit too, if you'd like. And please come off mute or put questions in the chat. Okay, I want to see some emojis. If you are all set, because we're gonna share out a bit here. If you've gotten through it, I want to see emoji, please, like a thumbs up or a smiley face or something, and I will give more time if folks need more time. Thank you, Brian. Thank you, Monica.
Hey, Leslie. Is there another way someone could access the link? Because I just got a message that their organization is blocking the link.
Oh,
Mhm.
great question. Um, Let me see if John can answer that question since he
Uh,
happens to be
I
on.
will, I'll take a quick look and I might drop a different link in the chat here just in a second. Give me a moment, okay?
Okay.
Thanks, John. It's always helpful when we have John on a call to be able to support with that type of thing.
Yes.
He'll work some magic, hopefully. All right. It looked like I got a lot of emojis um, of folks saying that they're ready. So if you're not quite there, that's okay. This is as folks start sharing, you can wrap up, share as it comes, and hopefully whoever was having trouble accessing, we can get that worked out for you right away. Because I imagine this will be a hard to follow experience if you don't actually have the toolkit.
John just added a link in the chat, which could work if.
Okay.
Now, if that doesn't work for the person having trouble, drop your email in there and I'll send you a copy right now.
Excellent. Thank you. Okay. So what did you find? I want to know one possibility that you found. Maybe a funding source, partner, or resource you want to learn more about. And Brian, if you're talking, you're on mute, but maybe you're on a separate call.
Yeah. One
All
sec.
right.
Phyllis has a
Yeah, go ahead.
question.
Yes, please.
Hi. Hi, this is so much fun.
Hey, Phyllis.
Hi. I so we have been thinking about this in our area, and we have this, it's kind of like this little engine that could, but we have a CBO with a community health worker, and they have a committed clinical provider, and they want to just test the PFS community health integration codes.
Okay.
So it's just kind of like they want to just start and do it and see what happens. Is there anything along this line? This is kind of like they have funding to do it. They want to pilot it and they want to go for it. So that's kind of, I don't know if this is getting farther along from where we're at, but it's just kind of like we have people who are ready and
Yeah.
want to do it, but
Yeah.
I think there's so many barriers to it because it's not, we're having a hard time finding anybody else who's done it and want to just like
Yeah.
connect with others. And so I think one of the barriers to trying these things is that there's so much unknown, even though there's a lot, there.
Absolutely. So I think that when it comes to like piloting something new, right? I mean, I think there's a couple of pockets of folks that are thinking about that, right? Are thinking about these codes and how they pilot the codes. And um, so it might be that then as you're, and we're not quite, we're getting to that point in the toolkit, right? Where it's like, what else do you need to do? Who else do you need to talk to? So at the moment, right, you might say, oh, okay, well, a funding source, could be, I forgot if did you say you were thinking about the PIN code or the CHI code?
The chai.
Yeah, yeah. So it could be, okay, chai is one of the potential funding sources. And you've got some of those things to be thinking about. And then if the barrier to it is actually about like getting more information about how it works, um, to be able to, press play on a pilot, um,
Mhm.
then as we get through this, when you get more into like your tactics and that kind of thing, it probably would be about doing, an outreach campaign. And maybe part of your pilot is that you're bringing in paid advisors or,
Mhm.
um, and so, you're starting to build a strategy around it where it's like, okay, the only way we're going to be able to press play is that we've got outside consulting
Yeah.
or we need information from other groups that have done this. Maybe you all need to hold a community of practice, and make a call out to, CHWs across the nation that have had any success or have been trying to pilot this or work through it.
Yeah. Okay. Cool.
But yeah, I would say at this phase, it's more like find the, it's we're at the identify the funding source, but hold on to that thought because we're getting there.
We got there. Good.
How about others? Other things coming up for folks? A funding source, a partner, a resource you want to learn more about? Maybe as you were looking through that.
Hi, this is Dina from Healthy Alliance. So I guess where my mind is going is it really, we could all talk about it, but the structure of our entities also plays into this, right? So what we can do, what we can't do, what we're able to do in terms of entity structure and what we can go after and so on. So it's interesting to talk about the other opportunities, but I'd also be curious if it applies to all. Is it applicable across? Probably not. And so where then, what questions do we have to ask ourselves as we're thinking about the blending and braiding?
Yeah, I think that's a great question, Dina. So in the toolkit, we actually one of the pieces which I didn't put into the training today, but one of the pieces is about like what capacity, like administrative capacity you have, for instance, to be able to like if you don't have the administrative capacity to coordinate multiple funding sources, who might you partner with that could? So a lot of it is about that sort of like just partner mindset of like, if rather than it being like, oh, we can't do it and that cuts us off from even imagining it, right? It's like, okay, if we wanted it, if we wanted to go there, who do we need to partner with? Who do we need to be in
Right.
relationships within our capacity?
Yeah,
Who can we partner with? And if it's not us, who else could partner with them? And then what's their connection or relation back to us?
yeah, and I think that's what that's what we're doing, and we have a consultant, but we're working through like not only introducing it and building it. We have a care management team, but building in the CHW specific work and also building it out amongst our hundreds of partners within our network, and introducing it there and then introducing it into the clinical space and building our relationships with clinical partners and the PCP offices and the PCMHs and so on and so forth. Like you're trying to do all that while you're trying to, you have 7 applications in for RHTP, right? And so you're trying to do rural health and you're trying to do the waiver work and you're trying to do, so you're like, okay, how does CHW, and that's why I bring that value prop in, is you start to pick your target audience, but then you have to think about me as an entity. Like if I'm not in the Medicare space right now, and maybe I'm never going to be, just hypothetically, and some of these options might not be an option, right? Or
Mhm.
am I a 501(c)(3) where I can go after, I have to be a not-for-profit status in order to go after some of these dollars or whatever the case might be. And then not just for us as the lead entity, but for the organizations that we're working with who are also trying to get them to stand up a CHW. It's what questions do they have to ask themselves? Is this the right space for you to be in? And what would you have to go through? What would the lift be? What would the cost be? What would the work effort be to get there?
Yeah, which I think is where I think what you're speaking to, that analysis, that level of analysis of like, is this even worth it is also a big piece of the consideration of, is it truly sustainable or not, right? Like, applying for 7 small grants, is that worth it when you could be going after, 2 other sources that have more sustainable opportunities around them is also in the mix of your value proposition question. But I appreciate you elevating the complexity of this, and it is complex, right? Like I think we did our best in that this is probably the most complex part of the toolkit, which is also why we were like, let's talk about it. This is really complicated stuff, and it's hard. And we tried our best to simplify it, to simplify something that is not simple, to at least be able to speak to this is the process, but it by no means takes the amount of time it takes to read it is so much smaller than the time it actually takes to put any of this into practice and implement it. You're talking about years oftentimes to put a really sophisticated level of braided or blended funding into practice. There are more simple versions of it too, but the level you're talking about is quite sophisticated and complex. Jasmine, I see your hand up.
Yeah, I think that the other thing is also sometimes when, like right now, SC Thrive's a nonprofit, and what we do is basically Medicaid, SNAP, TANF, Well Vista, all these applications, and we can do them over the phone, and we could do multiple applications and submit them to all the agencies. So that's one way that we're helping our community with that barrier of transportation and just trying to figure out these applications. And then we ended up getting a grant from a big insurance company, and they decided, let's try the CHW program. And so this is like new for our nonprofit, and just trying to, we're able to help people, which we've kind of blown out the number that we were supposed to do, but it's a matter of now, who else can we try to bring in to cover, to keep the program going. And then of course, depending on the grant you get, and they have certain requirements. They only want you to service this amount of people. They want this kind of documentation. They want that kind of proof. And although we've helped many people, to get them back on the phone to do that follow up, to kind of see what we did, if it actually helped them, to get them on the phone is absolutely nightmarish. So I think that's one of those other things of just trying to figure out how to give everyone what they want and be able to sustain what we're trying to do. And sometimes it feels like it's more work just trying to get that follow up and to show and prove that we've actually done something to get those grants to want to keep funding. I guess that's where it's at
Absolutely.
sometimes.
Absolutely. And Jasmine, thank you so much for raising that, because I think that's also, that brings up another type of activity. So depending on the level that you're talking about, right? Like you can be at, multi-system level, or when you're talking about a single nonprofit, all of these different levels of coordinating partners and investments looks really different. But when you're talking about a nonprofit, right, where there's certain activities, evaluation being one of them, hey, we need to be able to show our impact. Like if you as a nonprofit start to break down all the different things that you have to do, all the different activities, right? There's care coordination, there's showing our impact, there's, direct outreach, direct service, et cetera, all those things, then you can actually start to look at it and say, well, who else cares? Who else cares that that we're able to show our impact? Who else cares that we're able to get those follow-ups or closed loop or et cetera? And that's where that's where some of this mindset around braided and blended funding actually can really be quite advantageous at a nonprofit scale. If you can look at it as like, oh, there's different activities where we actually might be able to fund just that discrete activity versus the collective of all things, is something to consider. But I appreciate you raising, right, where all the different tension points are. All right, I'm going to move us along because I want to get us to a break, since this is a long time together. I did build in a break. So I want to say we'll take a 10-minute break. Before I say that, I just want to appreciate you all so much for participating in what is, I mean, this is a challenging thing to do, right? And I know there was the mention of like rural health transformation, all the things, all of the demands, all of the requirements showing up for you. Thank you for hanging in here with us. We'll come back at it'll be like 50 after. I'm on a different time zone, so I'm trying to be mindful of time zones. So 50 after, we'll come back together.
Right? No problem. What time did you say again?
50 after. So in 10 minutes.
I'm putting a timer if I could get it done correctly, but I'm putting a timer.
Like the timer music. That was fun.
Yeah, me, I'm gonna fix that, the timer.
All right. Hey, welcome back. Hopefully folks are back. Let's see. Maybe we'll see some emojis in the chat or on screen for how you're feeling at the moment. What's your emoji for how you feel after a break? Much needed stretch, bio break, maybe some food. All right. So this is where the fun really begins. At least this is my favorite part. Um, okay. So now we have some possibilities, right? You did some brainstorming, looking at some possibilities. But identifying a possible funding source isn't enough. And Phyllis, actually, some of what you were raising really speaks to this, right? Like, hey, we have this idea, but like having a thing where it's like, oh, we want to do a pilot or we want to pursue, Medicare funding or maybe, whatever funding it is. But that alone is it's not enough. A funding opportunity doesn't move itself. People make decisions, people influence decisions, people build relationships. And you might recall this image from our last webinar if you were with us last time, or if you've come to just about anything from Envision, we love to show this one. This is Envision's approach to sustainability. And this really centers on growing CHW power. And it focuses on how it's really through relationships and align interests to motivate change and drive collective action. So this is directly connected to getting decision makers to say yes. So now we're going to shift from funding possibilities to people and influence, right? The idea of like how do we go from a maybe to a yes or a no to a yes or a, I don't even know anything about this to a yes. That's all about people. Okay. So a financial strategy is really a relationship strategy. And this is something CHWs already know, right? Y'all already know how to do this. Very few financing decisions happen in isolation. There may be people who control the resources, people who influence those people who provide information, people who have relationships, and people who are directly affected or impacted. So the question isn't simply who has the money, right? That's like only a tiny, tiny part of it. It's actually who has influence over whether this happens. All right. So we're on toolkit stop number 2 then, right? We're going to go back to the financing possibility you identified. So you've thought about, okay, I've got my one thing, thinking about financing possibilities and those financing possibilities are based on who else cares about the outcomes that of my one thing or who cares about investing in this. So now we're going to use the toolkit to think about the people around that opportunity. And we speak to this throughout the toolkit. So there's like a lot of different places where you would find essentially the same message over and over. But I'll say that on page 74 and 84 to 85 are some where it gets us a little bit tighter. So if you wanted to take a look at that while we get into the next thing, but we've got a lot of places where it really speaks to this key idea around relationships and that much of what we have to do is really map those relationships. And I guess I also have other pages that I've listed here too, like page 65, 73 to 74, 86. So a lot of different spaces that you could go through. You could, flip through the whole toolkit and you'd find a lot of these same messages. The goal here isn't, we're not going to try to map everyone we want to make this manageable. So looking through things a little bit, identify one person or group who has some influence over the financing decision. So, one of your financing strategies, what's a person or group who has some influence over that financing decision? And then identify one person or organization who could help you get there. And then maybe thinking about, okay, maybe there's folks that I don't have a connection with, but I need to develop that also might strengthen my strategy. So really what we're thinking about is who has a stake, who has influence, who has credibility, who can open a door. And I want to note something here. There's a section in the toolkit where we talk about decision makers and this idea of a decision maker. And a lot of times, when we think about decision makers, right, we're thinking about like, at least in organizing spaces, a lot of times we're talking about, elected officials, or you might be thinking about, the director of an organization. And that's all true, right? It might be a public health director, a clinic manager, hospital administration. It might also be a foundation program officer or a school district leader, a city or county staff member, or a manager at a community-based org, and yes, also an elected official. So it could be any number of things. So keeping that in mind, I want to give you some time. So this is more activity, right? More time to dig through a little bit. I want to give you some time to think about this. Who has a stake? Who has influence? Who has credibility? Who can open a door? So identify and write down one potential decision maker, one potential ally or partner that you already have, someone that you're already in relationship with, and maybe a relationship that you need to develop. And again, you can look through those parts of the toolkit. Here, I'll take you back for a second. Pages 65, 73 to 74, and 86 might be some good stops in the toolkit to consider this. You also might just know it. This might just be something that you already know, and that's fine too. I'll give you about 5 minutes to come up with answers to these three: potential decision maker, ally, partner, and relationship you need to develop. Any questions on that instruction? Anyone just joining us that's like, what are we supposed to be doing? Throw a hand up, come off mute, toss your question in the chat.
Yeah, I don't see anything at the moment.
Thanks, Soledad, for
Mhm.
keeping an eye on things.
Yes.
All right, let me see a thumbs up or a smiley face if you've got your answers. You're good to go on. Thank you, Phyllis. All good. I'll give more time. As you finish up, please throw a emoji so I can get a sense of when folks are ready to move on. Okay. All right. Let's talk about this a little bit. Whoopsies. Stay here.
Do you want me to put the
Yeah.
link
Huh?
again? Okay.
Oh, the link for the toolkit?
Yes.
Yeah, that would be great, just to be sure that folks have
Okay.
it. Sure.
Okay.
All right. So who is a decision maker or person you're thinking about now? Who came up for y'all? You don't have to give like an exact name if you want to just give their title or something, but who's the decision maker or key person that came up in your brainstorm? You can put it in the chat. You can come off mute. I saw thumbs up emojis, so I know folks came up with something.
Yeah.
Who are y'all thinking? Who is a decision maker? Or maybe it was a relationship that you need to strengthen or an ally. All right, thank you. Phyllis,
I,
CEO and Board of Directors. Oh, go ahead, Brian.
I just said community donations
Yeah, so okay, so donors
as,
from the
as a
community.
relationship you need to
Yeah.
develop.
Yeah, all right. Great. And Phyllis, I see CEO and Board of Directors. How about other folks? CHW Association. Yes, so important. And did you have the CHW Association as the decision maker or an ally or relationship to develop? I was just curious because they could be any of those three.
For the CEO and board of directors was the decision makers.
That was the decision makers. And Anna, how about you? Oh, Anna said, I think it could be ally and or decision maker. Yeah, right on. All right, I want to make sure y'all have some identified folks in mind as we go into the next activity. So you're going to have some identified folks in mind. We're going to go into our next toolkit stop, which is understand the decision maker. So even if you didn't put the decision maker in the chat, I'm hoping you have at least a decision maker in mind, right? Somebody who is the one that needs to say yes to be able to move funds forward, say yes as part of a funding source that you're thinking about that could fund your one thing. See the path that's going here. Okay, so in the toolkit, pages 86 to 97 give us a real range of information. So that's our next stop. And really what we're doing here is around analyzing the decision makers. The toolkit gives us a much deeper process for understanding decision makers. This process that is in the toolkit comes from a core community organizing strategy. This is a central strategy for moving a no or a maybe or a I don't know any information to a yes. So this is the how to get to yes kind of approach. We don't have time to complete all of it today. Instead, we're just going to practice with three questions. Where does their power come from? So when you think about a decision maker, whoever that decision maker is, they get to make a decision because they hold some sort of power. They hold some sort of ability to make stuff happen. So where does that ability come from? Where does their power come from? And who or what influences them? And what do they care about? And this is where our financing strategy starts to become an advocacy strategy. And it helps us to think a little bit about what does the decision maker need from us? So I want you to just start doing some brainstorm here on what gives this person their power. Is it because they're elected and they got into power through through constituents? Yeah, there you go. Jasmine says elected officials representing their community. There you go. So they got their power because people voted them into power. They're accountable to those people. Those people can vote them out, is what that means. So power is not, when it comes to positions of power, right? Positions of power are not necessarily forever. There's always something else that holds them accountable to that position of power. You know, a CEO is in their position of power, but they could lose that seat if they aren't good stewards with the dollars, or if they are if not saying we use these tactics, right? But if the media showcases something that is negative about that CEO, sometimes you see a CEO stepping down. So people's positions of power are not forever. They get that power from something, and we want to know what it is. Actually, I'll take us back first. All right, take a few minutes to jot it down. And show me an emoji when you've got answers to these three questions. What gives them power? What do they care about? What and who influences them? And it's okay if you don't know all the answers. If you have to make it up for the purpose of the exercise, you can do that too. You can, run off of your best guess. Okay, show me some emojis when you've got the answers to these questions. All right, I'm starting to see some emojis. Folks are thinking about it. All right. So this is where this is really where sort of the magic starts to happen, is when we think about then what does the decision maker need from us, right? This is where the CHW role becomes really powerful. We're not just saying, please fund CHWs because CHWs are important. We're asking, how does CHW expertise help this decision maker achieve something they already care about? And what does the decision maker need to understand about the reality of implementing this work? Maybe it's community knowledge, maybe it's data, maybe it's a story, maybe it's implementation expertise, maybe it's a relationship. Yes, yes, Jasmine, real stories, right? That's where CHW expertise becomes an advocacy asset. So I want you to take a minute and think about this. Based on your decision maker and what motivates them, write down the names of who else needs to be involved. Who are the CHWs to lead and give voice? Who are the allies you currently have? And who do you need to build relationships with to grow their allyship, to influence the decision maker? Right? Think about that. And I'll caveat something. CHW allies are individuals, groups, or organizations who share your goals or can support your effort. And so I want you to be thinking about the ones that can provide resources, credibility, or influence to strengthen your efforts. You don't need a complete coalition here. Just identify the one or two people who could make your next move stronger. All right. While you do that, I'm going to move us to the next thing. So be thinking about that, right? Who are the CHWs, the allies? Who else you need to build relationship with? And if you want, you can be popping things in the chat as you're thinking about it. And I'm going to move us to our last stop, Toolkit stop 4. Now we're at the point where you can move from thinking to doing. And in pages 98 through 101, there are a bunch of tactics. So this idea, this tactic, and I think I might have said the word before defining it, tactics are the specific actions your group takes to move your CHW plan forward. And tactic is the how behind your plan. You don't need the biggest tactic, you need the right first tactic. So oftentimes it's not some sort of big splashy demonstration. It might be a one-to-one meeting. It might be a presentation. It might be a storytelling campaign. So what we're really thinking about is what would make sense as a first move in your situation. And what you're really trying to get at is what's the right size, the right moment of tactic that will move closer to my decision maker getting to a yes. So I want you to select one and write it down, right? You can write down my first action and then write down one step needed to make that action possible. And I have an example on the screen. Like if your first action is CHW Association is to hold a one-to-one meeting with the hospital administration or administrator, then my one step needed to make that action possible is just to schedule the meeting. And I'm going to be specific. Schedule a meeting for the month of October. So that's it. Just take a look through 98 to 101. Consider what makes sense as a first move in your situation. What might be a first tactic? Is it a one-to-one meeting? Is it maybe there's something else that needs to happen? Phyllis, we were starting to brainstorm a little bit, right? Some of your tactics might be that you're needing to pull together a community of practice, or maybe you're needing to, get on the phone with a couple of key uh, subject matter experts just to find out who else is doing this. I would suggest maybe you need to talk to Sherry, my Envision colleague who has a ton of expertise around Medicare and Medicaid, and who else in the country might be doing it. Yes, see, Phyllis, you're already there. Okay. So then we're getting into, right, this is the action piece. I'm gonna bring us to a close as you're considering your action steps. And the reminder really is that you don't have to control the money, right? Today wasn't about turning you into a finance expert. It was about helping you to see where you already have expertise and influence and giving you a way to use it. And that's really the central message of the toolkit. You don't have to control the money to influence where it goes. You can bring the community perspective. You can explain what it takes to actually do this work. You can demonstrate impact. You can build relationships. And you can help decision makers understand what sustainable CHW financing needs to look like. So I want you to take a look at what we've built today, this process. You started with one real piece of CHW work. You explored why it matters. You considered who else might care about it and what financing possibilities might exist based on that. You identified someone who might need to be influenced, like a decision maker or a CHW association that might be an ally and a decision maker. You thought about what they care about and what CHWs bring to that conversation. And you identified a first action and a next step. So that's the beginning of an advocacy strategy to sustainably fund CHW work. You didn't complete the toolkit and you weren't supposed to, right? So that's not it, right? But this is sort of the skeleton of the toolkit. And you used pieces of it to start thinking strategically about something real. And you can now return to the toolkit and take any of these pieces much further. And I would encourage you to do that alongside other folks in your team, right? Don't be doing this all individual the way we did today, but do it with your team, and importantly with CHWs leading that effort. So I'm going to do just some final takeaways before we get into our evaluation, and I think a little bit of time for questions. So if there's one thing I hope you take away, it's that financial sustainability isn't just about finding funding sources. It's about CHWs recognizing the power, expertise, and leadership they already bring. And sustainable financing is strongest when CHWs are not just included in the conversation, as I was just alluding to, right, but are shaping decisions, priorities, and strategies that affect the workforce and the profession. And you don't need all the answers today. You just need a place to start. So with that, I want to thank you for being here and for the leadership you all bring to strengthening and sustaining the CHW workforce and profession. And we can move into evaluation and Q&A.
Yes, thank you. Thank you so much. Thank you. Yes, yeah, and all the claps because it's a lot of information, and this was definitely a deep dive. And one thing about Envision and what we do at the Southeast Network, we really take our work seriously. And because of you, you've all asked for this, and we want to make sure that we deliver. So please answer this webinar, and it's because of you all. You putting in your thoughts. We know what to put in front of you. We know what is needed. So fill out this survey that just popped up on your screen. It's an opportunity for you to, put some of the information, what you got from this, and that is some great information we would love to take a look at. Yes. Again, thank you, Leslie. Okay.
Excuse me,
And
while I was on mute, I wanted to
it's okay.
I did want to offer also, I see there was some questions about contact information. And if
Yes.
folks are looking for more information about Envision or CHW Financial Sustainability Toolkit or reaching out to my colleague, Sherry, as I mentioned, feel free to contact me. You can also contact us at, is it here somewhere? Well, anyway, it's hello@envisionchws.org.
Hmm.
But I do have a few minutes if folks have questions. Thank you, John. Thanks for putting that in the chat. I recognize this might have been quite the brain squeeze. But if you have anything left and you have any questions, I'm happy to provide.
Yeah. All right, so I'll take this moment to pass it over to Kim, who will have the opportunity to close this out.
Thank you, Soledad, and thank you so much, Leslie, for this webinar today, a wealth of information. And thank you all so much for being here and participating, engaging with the financial sustainability toolkit. So thank you all for being here, and thank you. We see that you all are completing the evaluation. And as Sarah put in the chat, we really do look at what you all put on these, and it really helps us to identify opportunities to better serve those of you who participate within the network. So thank you so much for being here. I think we do have a slide about an upcoming webinar that is scheduled for next month, and it's on networking, which was another topic that you all said that you all wanted. So we're going to be talking about beyond business cards, networking with a purpose or with purpose on September the 10th from 2 p.m. to 3:30 p.m. Eastern Standard Time. So hopefully you all are registered for the listserv because we will be sharing more information there and how to get connected so that you can um, attend the webinar that's coming next month. And that's all that I have. So thank you all again.
All right, everyone. Well, enjoy the rest of your day. Thank you for taking the time to just learn and grow with us. And we hope you definitely, well, we know you gained a lot, but definitely share this with your colleagues so they could get the information as well. So enjoy your day. Take care,
Thanks
everyone.
all.
Yes.